Welcome to USMLEFasttrack.com. The section we're going to talk about today is from First Aid for the USMLE Step 1, 2013 edition. Page 264. Baroreceptors and chemoreceptors. What nerve does the receptors of the aortic arch transmit through? Aortic arch transmits via the vagus nerve to the solitary nucleus of the medulla. Additional note about the aortic arch is that it responds only to increase in blood pressure. What nerve does the carotid sinus transmit through? The carotid sinus transmits via the glossopharyngeal nerve to the solitary nucleus of the medulla, and a note about this is that it responds to decrease and increase in blood pressure. Describe the function of baroreceptors in response to hemorrhage. In hemorrhage, you would have severe hypotension. This would lead to decrease in arterial pressure. So since the pressure in the arteries is going to be low, this would mean the stretch of the aorta and other arteries would be decreased. This would lead to decrease in afferent baroreceptor firing and would increase the efferent sympathetic firing and decrease the efferent parasympathetic stimulation, which makes sense because due to hypotension, severe hypotension, you would have an increase in flight or fight response and decrease in the rest and digest response. And this would cause vasoconstriction, increase in heart rate, increase in contractility, and eventual increase in blood pressure. What is the carotid massage? Carotid massage is when a physician can massage the carotid artery, and this would cause the increased pressure on the carotid artery. This would lead to increase in stretch, increase in the afferent baroreceptor firing, and this would cause the heart rate to decrease. What is Cushing's reaction? Cushing's reaction is a triad of hypertension, bradycardia, and respiratory depression. How does the baroreceptors contribute to Cushing reaction? The way baroreceptors contributes to Cushing reaction is that when there is an increase in intracranial pressure, it would constrict the arterioles. This would lead to a cerebral ischemia, and in response to this, there would be a reflex sympathetic increase in perfusion pressure. This would lead to hypertension. In hypertension, it would lead to increase in the stretch of the arteries. This would lead to a reflex baroreceptor-induced bradycardia. So this is how baroreceptors can contribute to the Cushing reaction. How are the peripheral chemoreceptors stimulated? The peripheral chemoreceptors at the carotid and the aortic bodies are stimulated by the decrease in PO2 if it gets less than 60 mmHg. They are also stimulated with increase in pCO2, and they are also stimulated in decrease in pH of the blood. How are the central chemoreceptors stimulated? The central chemoreceptors are stimulated by the changes in the pH and the changes in the pCO2 of the brain's interstitial fluid, which in turn is influenced by the arterial CO2. What does the central chemoreceptor not directly respond to? The central chemoreceptor does not directly respond to the PO2. For more information on this topic, click on the link in the description section below. For a full USMLE Step 1 review, be sure to check us out at USMLEFasttrack.com, where we help you review the entire first aid for the USMLE Step 1 with high quality videos and hundreds of detailed pictures for a better understanding of the material. So to learn from the best USMLE review book, be sure to check us out at USMLEFasttrack.com.